panel discussion where it is very relevant to us because Tamil Nadu is a global healthcare hub exploring technology, medical tourism and specialty care. That's the topic. So it's a very interesting and it's very relevant to Tamil Nadu and especially Coimbatore. So we have a great lineup of speakers. We have Dr. Bhuneshwaran, the director of PAG Hospitals, and we have a combination of she's from Ramakrishna Group, as well as she herself a founder of a health tech startup. And then we have Dr. Vijay Kumar from GKNAM. So it's a great combination of panelists that we have. It's going to be very interesting. To start with, Dr. Bhuneshwaran, what are the key factors that have contributed to Tamil Nadu's emergence as a global healthcare hub?
Good afternoon, and thank you, Mr. Satish, for getting us on this platform. See, Tamil Nadu, as it's very statistically known, it's been a leading healthcare provider in the nation, in India. And in fact, if you really look at the statistics, which are really so impressive to know that we have been leading, the reasons are, number one, the lucidity of the healthcare. What I mean by the lucidity of healthcare, we have almost a total solution for any healthcare issue, either through the standard Western medicine or through the so-called the other medical fraternities like Ayurveda or Siddha or naturopathy and yoga. As well, we have an excellent congregation of multiple single specialty hospitals. It's something which is very unique in fact, even in Coimbatore, we have a lot of so-called single specialty hospitals. Like, for example, you take for eye or for the bone or for the gastro. So in that way, excellent infrastructure, a lucid 360-degree availability of the healthcare, excellent connectivity, as well, I should really place it on record, a very good support from the government of Tamil Nadu. In fact, you know that Tamil Nadu government is one which is now made Tamil Nadu as number one in, for example, organ donation. Like, Tamil Nadu is number one in the whole of country in organ donation. Thanks to the excellent support of the government of Tamil Nadu in supporting all the healthcare facilities, both government and private, in supporting in brain death identification, etc. So it's a very unique combination, and there's no surprise that Tamil Nadu gets almost 1.5 million visitors, seeking healthcare tourism in Tamil Nadu. That's almost around 15 lakh people keep coming to us.
Thank you. So my question is to Dr. Vijay Kumar. So, how has the integration of this cutting-edge technology such as AI, your robotics, all this transform the healthcare landscape?
No, certainly the AI has been there with the robotics for more than a decade now, but slowly is getting into country like us. Definitely, for a minimally access surgery where, you limit the scar to make it cosmetically appealing for the patient, and also to do some complex dissection in an area where it's difficult for a man to get in. For example, in the pelvis, retropelvis, which already the tumor or any lesion is very extensive, where the precise dissections may not be possible all the time. That's it. That's where the AI comes in, the robot comes in, mainly for pelvic malignancies, urological malignancies, where it can invade the blood vessel, where you need to have precise, accurate dissection. And also when tumor involving the spine, especially the nerves, okay, even a small amount of cautery where we use to cut the tissue can cause a nerve palsy. So those areas, AI play a very huge role. So definitely AI is coming in a big way. I think in Coimbatore itself, 4 or 5 big hospitals, all of them has a robot, and we are doing the work. So yes, as a physician, we are also getting tuned into the robotics. The only thing with that is it's a little bit expensive. We need to have a lot of infrastructures. Mainly if something goes wrong, we need to have engineers all around to fix it then and there itself. And as a physician, as a surgeon, we do feel like our touch is being lost by the machine, or replaced by the machine. But definitely, yes, AI has a long way to go. It has been very helpful in robotics.
Thank you. Swati, to you, how has startups leveraging emerging technologies to address key challenges in healthcare?
So I've had the opportunity to actually be on both sides of the coin. So I'm working in traditional healthcare, running a hospital for about 20 plus years. The number one thing I'd say about Tamil Nadu, right? I get at least on a minimum 4 calls a day from either my friends abroad or in the country asking, what do you think is the best to do? What are the options? And why 100 out of 100 times I actually suggest Coimbatore? It's not because I'm from here and a couple of other centers in Tamil Nadu is jokes apart, right? Like in all honesty, I tell them, where else can you get your heart condition treated? And taking a point from his integrative medicine saying, go for an Ayurvedic consult on the same day and actually have a dosa for dinner, right? So, but that's really, health, wellness and happiness all on one day and all in one plate. So that's why I'd say come to Tamil Nadu. But looking at the whole startup ecosystem, I currently work in tech. We're doing an AI co-pilot for mental health counseling. So I work in that. And when we look at the ecosystem, it's also a very integrated ecosystem, right? I've had also the opportunity to work across many states in the same healthcare ecosystem. And they all work in silos. But surprisingly in Tamil Nadu, what's really accessible is once you're doing anything in this ecosystem, you actually have access to the top specialists, to the top hospitals in any avenue, right? The outreach is super simple. They're all simple people. And the willingness to actually open out for research, whatever it is that we're working across both holistic as well as traditional systems as well as, the healthcare ecosystem is super easy to reach out. So they've been embracing in the ability for us to run our pilots, for us to actually work with them on several fronts. And that's what's made it exciting. And that is what is exciting about actually doing a startup out of, most people usually raise eyebrows when I say we're building this out of Coimbatore and Tamil Nadu. So.
Thank you. So medical tourism is a significant component of Tamil Nadu's healthcare growth. So what are the unique advantages Tamil Nadu offers to international parents compared to your other destinations, like even some of the international destinations like Singapore or other destinations?
In fact, it was really booming very well just prior to COVID. In fact, why I say this, there were so many exhibitions which were conducted outside the Tamil Nadu. The government itself again has an avenue through which many of our, even the Coimbatore hospitals, Chennai hospitals, the chain of hospitals have represented themselves in various places. So number one, the first requirement of that we are known outside India, that India is a very good medical tourism destination, number one, because we have been very well advertised and marketed, number one. Number two is Tamil Nadu has a very good connectivity. See, we are again very well connected from both the west and to the east. And in fact, in that way, I have a small grouse that Coimbatore somehow has been, we have been trying our best. In fact, even it's in the papers yesterday, the airport expansion lands have been given, but there is some gap between the center and the state, which many of you know that there is something which is not connecting. But anyway, still we are well connected to Singapore now, and this side now to the Abu Dhabi, thanks to Indigo. And so connectivity, Chennai is very well connected. So that is number two. Number three, most of the hospitals which advertise themselves, many of them have certain very special ability. For example, you take, I can immediately quote one hospital in Chennai. You take Ralas Institute. They are now internationally known for the liver transplant. And thanks to the Coimbatore, some of the hospitals for the eye and for the, again as I say, for the spine, we are very, very well known internationally. That means the expertise is available. The third one is, interestingly, if you really go into it, Coimbatore takes a lead in getting all the best possible equipments within no time. Like, in fact, recently we had acquired the linear accelerator, which is of the top notch, probably one of the best in the world, as well as for the imaging equipment. So that means Coimbatore or Chennai never hesitates in investing into the infrastructure to attract people. And most important, because the word health tourism itself means it is people who come here, they should be able to reach out to some destined spots where they can have a relaxation in addition to the treatment. Okay, that's why it's called as tourism. So that means, for Coimbatore is so very well close to so many natural spots. Chennai is so very well connected to so many other spots. In that way again, Tamil Nadu becomes at their destination for this. But now, after the COVID slowing, things are now definitely it's picking up. And interestingly, now almost all the major hospitals have got a department of medical tourism. That itself is we never had any such departments. Now we have all the hospitals, major hospitals in Tamil Nadu. Most of the multi-speciality hospitals have a department destined and somebody who keeps on connecting with people. So it is multimodal and it's happening.
Thank you. So with Tamil Nadu being home to some of country's top medical institutions, how do we ensure that the quality of healthcare in rural and remote areas also meet the global standards?
To me, right. I think just to add what Dr. Bhuneshwar said, I think why the people look at medical tourism, first of all, we should ask ourselves. Obviously, they're looking for a good health care which is not available in their respective countries. So they're looking at alternatives. We know the developed countries like United States or UK, it's very expensive. If I have to have a open heart surgery for myself or one of my family members, in Indian rupees it will be somewhere around 1.5 crores easily. So put it to somewhere $200,000. If you look at India or in for example in Coimbatore, it will be around $4,000, $5,000. You can take a suite or deluxe, it will be covered. So it's economically is viable for definitely kind of middle income countries where not many people have the insurance and they have to pay from their pockets. So I think looking at even for example the test, if you take a PET scanning or a CT, MRI, everything compared to the rest of the developed countries, ours are much cheaper. As SAR said, we have infrastructures. All the big hospital in Coimbatore, 5-6 hospitals have all the infrastructures. They can choose. They have, they can pick and choose based on the comfort. Plus, as Adil said, it's a tourism. They have other sites to go around. So that is why Coimbatore has been favored. But having said that, as he just said certain things which is hidden, we're still lacking direct connectivity to Coimbatore. Sorry, this is a thing I need to be critical about it, because that area we need to improve. Sir said it indirectly, we connected to Singapore and Abu Dhabi, but we need to have more connectivity. That is where this airport expansion is going to help. Especially, people from Africa, because they don't want to get into, say, Chennai and check out, clear immigration, take one more flight, get in here. They want to just get out, go to the hospital, get the treatment, and go back. I think that way, Coimbatore, we still need to go much more up. I hope it's going to be happening soon. Second thing is advantage for Tamil Nadu. I think this is especially the Sri Lanka, Singapore, Malaysia. Most of the people speak Tamil and they have some origin from here. Their ancestors were here. Because as he said, we went for medical tourism to Singapore and Sri Lanka, Malaysia. Once you speak Tamil, a lot of people want to come back and we do deliver a good thing. Okay, coming back to your questions, I think this medical tourism definitely, yes, we are looking up somebody who can pay full and whatever it is going to be expensive, but our people, not many of them can afford. I think how this medical tourism helps, if I make money from these patients, whatever the corporate, sorry, I may be rude, but that's a reality. Suppose if I do 10 patients from abroad, fully paid, I make some income, I can use that money for our poor patients. Okay, maybe he's administrator, she's administrator, they have different opinion. As a physician, if I do 20 patients who fully paid the bill, I can go and request, sir, I have 2-3 poor patients, can you subsidize? So certainly, if this is going to come, we can use that money for our patients. So that is how, as a physician, we want to impress administration. So definitely we are for it, and this is how we can, and our people also will get the subsidy.
Great. So the same question to you, Swati. So what is your take on it?
Talk about rural and how do we really address that? And I think that's where technology comes in and screenings, right? It's a huge, big thing. People don't talk and don't emphasize enough about screenings, right? All of us, hospitals and healthcare ecosystem, that's what we need to be doing more of, because anything, caught earlier on, it's less painful for the patient and less expensive for the entire ecosystem. Insurance works in the end, everything works seamlessly, and that's where great technologies like Niramai, for example, and like this, we all embrace and work together with all of these technologies to be able to run mass screening. So when you're identifying early on, then it's easy, right? And it's a lot cheaper on the ecosystem too. It doesn't matter, in the end of the day, I think we all learned from COVID that if everybody ends up sick in large numbers, none of us are going to be able to do anything. And also another great thing about Tamil Nadu is that we don't have just one city that's a large city with a lot of NABH or accredited hospitals, but we have multiple cities like that, right? So we're not in Karnataka, you can take one city that has that many, and it's always clustered. Whereas in Tamil Nadu, it's equally spread our developed cities, and the hospital infrastructure also is equally spread out. So it helps us actually as an entire industry to work together to be able to provide better for the rural patients as well. And I think that's what we do well in Tamil Nadu for the ecosystem.
Thank you for that. So, to Dr. Buneshwaran, so how can public-private partnerships in Tamil Nadu help to improve accessibility and affordability of the advanced healthcare services?
Actually the public-private partnership has been a concept which has been going on. Now, thanks to the company laws, which says a very significant allocation of CSR, the corporate social responsibility funds. Now, for example, now you take in Coimbatore, the government hospital, or you take many of the major hospitals in various places, two things have been happening interestingly. One, the government of Tamil Nadu's CM scheme, the so-called CM scheme, when it was introduced to all the hospitals except government hospitals. Okay. Now currently, the CM scheme allows the government hospitals also to take patients who are eligible for CM scheme. What is this exactly, the Chief Minister's scheme? The scheme says people who are below the BPL, below the poverty, that the economic cutoff of around 1 lakh, around 100,000 rupees a year income, these people are eligible to seek free treatment in private and government sectors. Now, why I say this, in the government sector now, once they have this treatment being done, there is an incentive amount which gets aggregated to the government. So for example, I was talking to somebody from CM scheme yesterday. One small hospital in Tirunelveli, a government hospital, where that hospital oncology, they have made an incentive by treating poor patients in the government sector hospital, have accumulated almost to the tune of 1.5 crores. And with the incentive, the government hospital there in Tirunelveli looks better than any of the private hospitals out. So what I try to say, now there are so many things. For example, there are various CSR funds through various big corporates have been now very well channelized to the government hospitals. And again, thanks to the infrastructure, the government of Tamil Nadu has always created various portfolios. For example, we have an innovation cell and we have a startup cell. And that way, many of the activities of the private and the government go hand in hand. And that way, interestingly, Tamil Nadu, when I graduated, we had hardly around 18 medical colleges. Now we have around 56 medical colleges in Tamil Nadu, and thanks to the announcement, we are going to have 3 or 4 more in other districts. In that way, we have been, the private-public partnership has been extremely positive in Tamil Nadu. Governments may change, but always the hierarchies have been so supportive to the infrastructure. It's been a win-win.
Thank you. So what role do you foresee in the growing importance of precision medicine and personalized care in Tamil Nadu's healthcare ecosystem?
No, I mean, it's already is there. The precision personal care, it's always there. It's been rooted into our blood. Especially it talks about the medical, tourism and health hub. When I receive a patient from, say, from some other Middle East, okay, my responsibility doubles up. I don't have any margin of error because somebody is coming so far, crossing flights. I have to make sure that they leave the country in the same state. If something goes wrong with that patient, it is a big issue for us. It's a medical legal. You need to inform the police, inform the government. You know how difficult it is.
Yes.
So whether it's a local patients, a rural patients, or patient comes from overseas, in medicine we try to get a 0% error. Okay, but it's not always possible. Humanly, it's not possible. But that is our goal. Yeah. Especially if somebody comes very sick, advanced stage, you explain. Yes. The family will take it up, provided we communicate, we'll discuss, we explain everything beforehand. So that is way we can get the impression from them, and then continue to do your best.
Okay.
I think the best thing is, I would say, keep informing the family what is happening. Yeah. In a regular manner. If I can't go say something, my junior can't go say something else, that is where the confusion happens. So clear communications, no margin for error, do your best and make sure that you have adequate infrastructure before you receive somebody from overseas.
Okay.
Otherwise, as you said, we have other hospitals, just kindly refer them. That they will appreciate rather than trying to do yourself getting into trouble. So I think you have to be honest and put your 100% effort to save the life as much as possible.
Thank you. So, to Swati, what are some of the biggest challenges you have faced in scaling your health tech startup?
A is anything you want to build today, right? In tech, data is everything. And it's when I went out there, and I work specifically in children's mental health. So whether it's children's physical health, mental health, adult health, mental health, everything is in silos. The quality of the data is the number one problem. Okay. So we had to start, basically, for our data sets, we had to start from scratch, creating our own, at the end of the day, collecting data from our own entire setup of people, rather than today. It's really hard, even for me, walking into an ecosystem, to explain why, even if it's declassified. So you have to actually get people to understand how important it is to share data.
Okay.
It is declassified, and we're still not, everybody in physical health, running hospitals, running large institutions, they're still running in the silo of traditional fixing for illness, right? So to explain that, why the quality of the data captured at the right time, under the right circumstances, is so important. And that's been hard for us, to the fact that we had to go build everything from scratch. And so that was really number one. Okay. And I think, and number two is, again, when you spoke about personalized healthcare, this is the start of personalized healthcare, right? It's not about that one instance of illness, but all of what happened before and all of what will happen after, right? Yeah. The ability to predict that with the past data set, right? So that is important, and that's where we really haven't embraced or started even thinking down that line. But today we're seeing really promising startups come up in that space, having done all the hard work, like literally, put in a lot of effort in that. And I hope more traditional healthcare systems will open up and share data and work together as an ecosystem to create that for startups and people building for.
Okay, thank you. Finally, just quickly by Dr. Bhuvneshwaran, how can Tamil Nadu's healthcare sector collaborate with the global organizations to enhance research, innovation, all that? Briefly.
Basically, again, it's all now so well connected, as a very well-known statement of Vasudeva Kudumbakam. See, I think the globalization is very much there, and Tamil Nadu, in fact, we keep seeing that if you take the United States, almost all the major corporates are controlled by Indians. Almost all the major corporates. Anyway, having said that, we have a very good soil, we have a very good atmosphere, we have a very good ecosystem, and we have excellent connectivity, and we have talent. I'm sure that we will definitely be coordinating with all the major global people. In fact, Google has done a lot of healthcare surveys in Chennai. For example, they have many of their artificial intelligence in the retinal reading retina, etc. So there are things which have been happening, and I'm sure that we are for a very, very excellent future.
Thank you so much.
Can I add
Please.
one thing?
Yeah, please.
Coming to this global, sorry, I know. So, I studied my fellowship from Mayo Clinic, United States. So, I do have a tie-up with the Mayo Clinic. Every year, the 10-member team comes and spend week with me.
Okay.
So, this February 17th to 22nd, I have 12-member team visiting from Mayo Clinic, United States. Okay. They're going to spend with me. It includes surgeon, entire team members, and they'll interact. So, it's all, as I said, the international agency looking for a good partner.
Yeah.
They want to come and do it. This is like a charity walk.
Right.
So if you open your eyes open or your hands open, people are there to come and help. So it's up to us to receive.
Yeah.
That way we can grow stronger and quicker.
Yeah.
Thank you, sir.
Thank you. Thank you so much
Thank
for
you.
a wonderful session.